Hi, this is Module 6, Discussion Board for Drug Abuse and Addiction. Opioid role is to relieve moderate to severe pain. They work by connecting to opioid receptors located in the brain, spinal cord, GI tract, and other organs in the body. The pain message is reduced, thus reducing the feeling of pain, the perception of pain. Some people, when taking opiates, experience euphoria. These opiate receptors triggers in the brain the feelings of pleasure, reduce anxiety, increase feelings of self-esteem, and they help with coping mechanisms. Opiates are also CNS depressives, very similar to morphine and heroin. Simply put, they slow things down. Some assessment findings are, but not limited to, slurred speech, lack of attention, drowsiness, respiratory depression, hormone imbalances, change in personality, change in grooming, change in who they hang out with, and paranoid behaviors. In our readings this week, we learned the difference between dependence versus addiction versus substance abuse. Dependence is developing a tolerance for the medication. You need more to achieve the same effect, and this can cause withdrawal symptoms such as agitation, anxiety, insomnia, and GI upset, to name a few. Whereas addiction is a mental disease that includes both physical and physiological and psychological dependence and is demonstrated by behavioral systems. Substance abuse is using medications such as painkillers, antidepressants, narcotics, sedatives, or other drugs without medical supervision and in a large quantity than prescribed. Continuing the use despite the ramifications to themselves and or to their family or society. Some of the behaviors that I have noticed in my long and varied nursing career are doctor hopping. They try to get prescriptions from different practices. Some of our patients come in telling us what specific pain medications work for them. Another frequent behavior I've noticed since I work mostly in triage is prescription fraud. Patients have been known to steal prescription pads and make rubber stamps with the provider's DEA numbers to obtain medications. I receive phone calls every day from pharmacists verifying prescriptions. Some of our patients call in requesting refills before time. A frequent ploy is, I lost my prescriptions. Can the doctor refill them? Today we had a patient come in demanding to see his provider. He did not have an appointment, and his complaint was he needed more pain meds. The triage nurse tried to calm the patient down, but he continued to become more and more agitated. The provider looked into the patient's chart and noticed this patient had been to several of our emergency departments and urgent cares. Of course, the complaint was always pain. He was denied everything. He's not happy with this. I know my practice setting is required to participate in prescription drug monitoring programs, otherwise known as PDMPS, requiring providers and pharmacists to log each filled prescription into a state database. This helps in finding those patients who are possibly getting prescriptions from multiple providers. Another intervention we use is the PMP-13 urine test. This panel is designed for the specific pain med that they are receiving under the pain contract. If the pain med is not present in the urine, then the prescription and the pain contract is null and void. Questions arise as to where are the meds going if they're not in your system? Are you selling them, etc.? Part of our intake protocol when we admit a patient is to ask the social questions such as, do you have a history of smoking? Do you use recreational drugs and/or alcohol use? This then prompts us to other questions to assess the patient if the patient is abusing. Unfortunately, in my clinic, we have a large percentage of patients that are poly-substance abusers. Some have abused prescription medication, but most of our patients abuse illegal drugs. We have protocols in place where nursing does not need a provider to initiate an order for a urine drug test, but the provider has to co-sign this order. Triage nurses cannot call in control scripts. These scripts have to have a hard copy. The nurse signs in the paper script in a locked log report. The patient must come in and pick up the prescription in person and must sign the receipt of the prescription in that logged report. Of course, patients are all aware of these policies. The patients come in for a urine drug screen. If the urine is clean, then the provider will write a prescription for the pain med. Of course, this takes time, so we educate the patient not to wait till the last day for medication refills. If this is not enough, then our providers give referrals to the pain clinic, to behavioral health, and if needed, to a rehab facility. Recently, one of our known drug seekers gave us a urine sample that was cold, not body temperature, and had used soap to create bubbles, the foam to imitate the voided urine. We have to again educate our patients on the dangers of taking medications without the provider, under provider supervision. Thank you, and I hope you guys have a great week.